So I had 5 questions that I wanted to answer for you today. One is, who am I and how did I get here? That might be one question you have on your mind. A few other questions, I want to talk about what is social networking. So we hear this term all the time. I want to actually explore what it is, what does it mean, why is it relevant to health? So why should all of us in this room care about social networking? Specifically, I'll dive into how we can use social networking to engage employees in their health. And then I want to share some evidence to answer the question, does it really work? So, as Justin mentioned, I was a first-year medical student back in 2005. And I was sitting in class listening to a lecture by a professor named Dr. Rena Wing. Some of you may be familiar with her. She's at the Miriam Hospital. She's one of the foremost weight loss and weight loss maintenance researchers in the nation. And she gave us a lecture about the rise of obesity in America. This was back in 2005 when many of us were just starting to open our eyes to the obesity epidemic. And you couldn't turn on the TV without seeing Governor Huckabee or President Clinton talking about the childhood obesity epidemic and really the national obesity epidemic. So she shared with us these CDC slides, which I'm sure you've all seen ad nauseum, but it was the first time I had seen the slides, and to see that we, over the past 15 to 20 years, have doubled or tripled the rate of prevalence of obesity in many of our states was really shocking. And I almost fell out of my chair when I saw this progression happening, and I got really interested in what was behind this and what it was all about. As a first-year medical student, I realized immediately that our entire healthcare system, our entire healthcare education system is focused on how do you treat disease after it happens. So everything we were learning in class was about when you have a patient who comes in with diabetes, how do you manage that diabetes? How do you treat that patient? And we weren't learning much about how do you prevent diabetes in the first place. What are the steps that we can take as a community, as a nation, to focus on prevention and prevent 50% of chronic disease, which is preventable. So I got very interested in prevention, and I decided to do some research and kind of explore this topic a little bit. So I wanted to share with you some of what I found. The first thing I found, and this is something we all know, but for me, it was kind of a learning experience, is that we live in a nation where this concept of bigger is better has flowed through every aspect of our lives. So the bigger your car, the better. The bigger your house, the better. And the more food you can pile on your plate, the better. And we live in an environment where this type of food is not necessarily uncommon for some people. So I think diet has really gotten out of control, as you all know, from portion size to the types of foods we're putting into our bodies. But that, as I talked to experts and did research, this was really a big part of the equation, was diet. The other part, of course, as you know, is physical activity. And we've found ingenious ways to cut physical activity out of our life, even though we were born to move. So, I hope this hasn't happened in any of your neighborhoods. This is the type of thing that we're seeing, or something like this. We're using really advanced technology to not move our bodies. And you see ironic pictures like this where people are taking the escalator up to the gym. This stuff is funny, and there is some humor to it, but there are some aspects of what's going on that are not funny. I began to learn a lot about childhood obesity and the fact that we're taking adult diseases and moving them down the age spectrum. So what was formerly called adult onset diabetes, we now just call it type 2 diabetes because 13-year-old kids come into the hospital with diabetes. There are now cases of 13 and 14-year-old children with heart disease, diet and lifestyle induced. I heard a case the other day of a 14-year-old girl who had a quadruple bypass surgery. So, we're taking adult diseases and moving them down the age spectrum. So that's when we need to start to be concerned. I think the entire nation is on the wrong track. We've become a society that is really not taking care of ourselves, and we're not prioritizing prevention and healthy living. And that's really why I got interested in being a part of this cause and joining all of you in promoting health and wellness. So I started a nonprofit organization to try to take action on a local level. It's called Ship Up Rhode Island, as Justin mentioned. And it was a community initiative to bring people together to help each other lead a healthy lifestyle. And that really came out of an insight that I had when I was seeing patients in the hospital. What I found was that most people were struggling with how to lead a healthy lifestyle. So whether it was trying to lose weight, quitting smoking, staying active, eating a healthy diet, Didn't matter if you were overweight or not, everybody was struggling with all these lifestyle factors. And I found that the people who were the most likely to succeed at changing their behavior and maintaining that behavior change over the long term all had one thing in common. And that thing they had in common was that they had successfully leveraged their trusted social network to help them succeed. So that means instead of going on a diet alone, instead of joining a gym alone, they did it with their friends, their family, and their colleagues. And they not only brought those people along with them, but they announced their goals, and they got those people to agree to be their advocates and to hold them accountable. And those were the people who ultimately succeeded and were able to change the social environment around them to be conducive to their success. So the idea was, could we use the internet, could we use this whole movement around workplace wellness to take an intervention like this and scale it across large populations? Now, we're obviously familiar with group behavior change therapy like Weight Watchers or Alcoholics Anonymous. And this was the idea of taking that concept, applying it in a broad way to wellness, and seeing if we could do that on a massive scale. So we quickly had some good success in Rhode Island, and employers across the nation started to ask us for a solution like this. I got together with one of my classmates, Brad Weinberg, and together we launched Shape Up the Nation. And we've since kind of pioneered this movement of a social networking approach to wellness in the corporate environment. And I want to tell you about it and what it means. What we discovered is that there's a real problem in healthcare, and specifically in wellness, and that's the engagement problem. So when Towers Watson and the National Business Group on Health did a survey on workplace wellness, employers identified the biggest obstacle that they faced was the lack of employee engagement. So employers spend a lot of money and put a lot of effort into rolling out interventions for their employees. And these are highly efficacious interventions, programs that when people participate, work, change behavior, and produce health outcomes. But the problem is we can't get people to actually sign up and participate. And so, like we tend to do in this country, when there's a problem, we like to throw money at it. So we've decided to throw money at the problem, and we're now spending a lot of money on financial incentives. And I think the statistic is particularly revealing. The average employer last year spent $154 on wellness programming and $430 per employee on incentives for those wellness programs. So if you can imagine spending $20,000 on a car and then $60,000 to put gas in the car to make it move, clearly something is broken. Well, I want to propose that while financial incentives may have a role in raising awareness about a wellness program or giving people a reason to participate, they're only part of the solution, and there's actually something much more powerful that we can do that's much more sustainable, much more affordable, and a more humanistic approach. And that's really to take a social approach to health and wellness. And, these are headlines that have occurred over the past couple of years, but this is something that's growing. It's a mega trend, and it's something that you're all going to hear a lot about over the coming years. And what's fascinating is that companies all across the nation are adopting this model to engage their employees. And it's not just the early adopters. So you will see, some insurance companies on here, Cleveland Clinic, Safeway, some of the wellness pioneers, but you'll also see blue-collar companies, manufacturing employers, transportation companies. These are all organizations that work with us to apply this social networking concept to their workplace wellness program. And they're doing it for one single reason, and that's because it's generating higher engagement than they've ever seen before. So let's talk about what is social networking and what is a social network. I think it's important to define it before we talk about it. And I always struggle with how to tell people what a social network is. And then I got this email the other day from LinkedIn. If any of you are on LinkedIn, you probably got a similar email. And I thought this was just such a fascinating way to illustrate what a social network is. Here you see a grid of photos. This is my professional social networks. These are people I went to college with, people I went to medical school with, people I work with. And what's interesting here is that this grid of people means probably nothing to you. You don't probably know any person on this grid, but to me, I can tell you a story about every single one of these people. So this is my social network. These are the people that I know and care about and who have an influence on me and who I have an influence on. And your social network is entirely different and unique and personal to you. And that is essentially what the social network is. And what we can do when we say social networking is it's all about how do we take that group of people and connect them together. How do we allow them to increase communication with each other? So how do we make it easy, facilitate sharing of information? How do we get those people to work together toward a common goal? So on LinkedIn, the common goal is networking or career advancement or whatever it may be, but how do we, in this case, take people and get them working together toward health and wellness? And then how do we get those people to forge stronger bonds to enhance their relationship? So that really is what social networking is. And the question then becomes, why is it relevant to all of us in this room? Well, there's a great deal of research that's come out showing that social networking is highly related to our health. You may be familiar with Dr. Nicholas Christakis, who is out of Harvard and has done a lot of research from the Framingham Heart Study database. He published his findings in a book called Connected and a whole series of papers that were published in the New England Journal of Medicine. And what he found was that because people are so connected to those around them, their health and the behaviors that lead to health are connected as well. And I want to share with you some of that research. You may remember a couple of years ago when the headline came out that obesity was contagious. And this was one of the illustrations that we saw. Maybe we all thought about running out and going and finding some new friends. But I think what was interesting about the study is that Dr. Christakis found that the people around us can influence our weight. So during the course of his study, when somebody gained enough weight to become obese, the people who were their friends, their mutual friends, meaning that person considers you a friend and you consider them a friend, were 171% more likely to become obese. And that effect held true for siblings, for spouses, and distance was not a factor. So up to 300 miles away, if you had a friend or a family member who gained weight, that person influenced you to gain more weight as well. It's a pretty dramatic finding that he discovered. And his conclusion was fascinating. It was that because we're so connected, we can actually leverage that connectivity to slow the spread of obesity. So while over the past 30 years we were all becoming more obese and gaining weight as a nation, there were people who were losing weight. And those people were losing weight in pockets, and they were influencing the people around them to lose weight. So if we can figure out how to harness that phenomenon, we can actually exploit it to spread healthy behavior. Dr. Christakis followed up with a study about social networking, about smoking, where he found that when people quit smoking over the past 30 years, so while obesity was rising, we actually did have a healthy phenomenon going on, which is we were quitting smoking. People didn't do it alone, they did it in droves, and they did it in pockets. And this kind of illustrates, you'll see areas of yellow, which are the smokers, or orange, and you'll see that it was those entire pockets that disappeared over time. And what he found was that when someone quit smoking, the people around them were more likely to quit smoking too. So if your spouse quit smoking, you were 76% more likely to quit smoking as well. Probably not hard to believe, but even a coworker at a small firm who quit smoking made you 34% more likely to quit too. So healthy behaviors can spread within a social network as well. He actually did a follow-up study about emotional well-being and happiness, and he found that when somebody moved from a state of unhappiness to a state of happiness, the people around them were more likely to move to that state too. And even a friend of a friend of a friend had a 5.6% influence on your personal happiness. So the emotional and mental health of the social network was contagious as well. And his conclusion was that if we can create interventions that modify a person's social network, we can be more successful than interventions that don't. There's also some research I want to share with you that was written about in a paper, in a book called Bowling Alone by Dr. Robert Putnam. Some of you may have read this. It's aging a little bit now, but there's some amazing research here in Bowling Alone. So what Robert Putnam talked about was that when people are more connected, their health is better. This is a graph of social capital versus a healthy state index. And a healthy state index is a measure that included about 40 different indicators of how healthy a state was. And the social capital index was a measure about how tightly connected people were, how much they trusted the people in their state, and how often they volunteered to be a part of civic organizations, something like a Rotary Club. What they found was that in the states that had the highest social capital, they also had the highest healthy state index indicators. And it's a pretty remarkable chart when you look at it. Social capital is highly correlated with the state being healthy. You can see Massachusetts kind of falls on the upward side there. So kudos to folks in Massachusetts for trusting the people around them and having a higher social capital index. And mortality was also lower in the high social capital index states. And you can see, again, Massachusetts just a little bit above the average there. So that the more you trusted the people around you, the more you were connected to them, the more you engaged with them, the healthier your state was. We also looked at happiness, and he found that the more often that we volunteer, attend club meetings, entertain at home, or go to church, the happier we were. Now, it only held true up to a certain point. There were some diminishing returns after you entertained at your house 40 times in a year. And you really don't like your friends all that much. But up to a point, you know, the more that we connect with the people around us, the more positive influence they have on our health and wellness. Coaching and disease management, which is a one-to-one phenomenon where you have one coach, one nurse, working with one person at a time. Highly effective in changing behavior, but hard to reach a lot of people, and definitely human capital, resource intensive, and certainly expensive. And then you have content platforms where we put out information like articles and videos, and we ask people to come and read them. That's a one-to-few model where some people will go and read it, but it's not really highly engaging. What we're talking about is this many-to-many concept, where you can engage users and empower those users to engage other people, and really create a viral mechanism where the people who are engaging are actually the ones who are reaching out to others, making the program relevant and making the program interesting. And this has a tremendous amount of benefit for those of us who are in this space, whether we're working on a community level or at a worksite level. Certainly it boosts participation. So when you have one employee who goes out and invites 7 other employees, you get a higher participation rate in your wellness program. We also sustain long-term engagement. So when employees are participating with each other, they're having fun, this becomes relevant, they take ownership over the program, they feel like it's theirs, they have much higher engagement rates over the long term. There's a lot of research showing that people lose more weight, that they increase their exercise more, that they have better outcomes when they have that social support network. So that's a crucial element of this. And because you're lowering your cost of promotion, and you're getting the employees to do a lot of the work, and because you can leverage technology to reach more people, you can have a higher return on investment. And certainly when you bring employees or community members together to support each other, there are so many other tangential benefits. So improved morale and retention, people look forward to coming to work, they form stronger bonds with their employees, and they become more productive. So what I want to do is actually share with you 8 ways that we think about how to apply social networking to a wellness program. At Shape Up Rhode Island and Shape Up Nation, we use our own software platform and some of our own programming to accomplish this. But this is something that any of you can do with or without our program. There are lots of different ways you can think about how to apply a social element to your wellness program. So I want to take a little time and go into that. So here are 8 things I want to share with you. One is, and this is really the foundation of any social network, is to create connections. And this doesn't necessarily have to be done online. I want to make the point that these are things that can be done online, they can be done offline. This may sound obvious, but it's amazing how few wellness programs actually connect the people who are participating in them with each other. So what we do is we encourage our employers to find out about their employees, to survey them and find out what are their goals and their interests, what are they looking to achieve, and then connecting people who have similar goals and interests so they can support each other. And we encourage the formation of teams and groups. And this happens in a lot of different ways. Some of our clients will motivate them to consider the idea of group coaching, where you can leverage peer support and accountability to make people more likely to actually engage with the coach, to have a better time when they're participating, and to stay with it over the long term. So that's the first idea. Anytime you're running a wellness program, think about how to add connectivity to it. That'll really become the basis on which you can build. The second, and this is something we talk a lot about, is hosting challenges and competitions. You hear a lot about gaming that's being done on the internet. I don't know if any of you play Farmville or any of these games, but at their core, these are all people coming together to either work together for a goal or to compete with each other in a friendly manner. And these can be individuals competing, groups working together toward a common goal, or teams competing with each other. And it's important to think about using game mechanics like rankings and points and prizes. And it doesn't necessarily have to be high monetary value prizes, but you can use the structure of a competition to motivate people and to provide accountability. Buck Consultants did a survey and found that by 2011, almost all employers at some point were hosting some type of worksite wellness competition. So think about how you can apply this friendly competition element to the wellness programs that you're on. The third, and we talked a little bit about this, is leveraging peer-to-peer invitations. So we often say that senior leadership support is so important when running a wellness program. And company culture has to come from the top down. And it does, but we also can't forget that there's a bottom-up component that's essential too. Employees need to feel like the program is theirs, it's meant for them, it's driven by them, and they have ownership of it. There's no better way to do that than leveraging your employees to invite each other to be a part of the program. So figure out a way that when an employee signs up for a wellness program, they can send some type of invitation to their colleagues saying, this is why I did this, and here's why I encourage you to do it as well. That can be done on paper, it doesn't necessarily have to be done electronically, it can be done by word of mouth. But the idea is you can get people to leverage their peer influence and get others to participate. It's much harder to say no when the person in the cubicle next to you invites you to be a part of a wellness program than it is when your CEO invites you and you can be part of this message. So when your friend says, let's work together and lose weight together, I need your help, be on my team, let's walk 10,000 steps a day, that's a hard message to ignore, and we find that people actually do accept that invitation. The fourth is facilitating conversations. So once you've figured out what employees are interested in, you've connected them around those interests, find ways to facilitate conversations. That might be in person, that might be online. We have clients that establish worksite wellness blogs where they'll talk about various topics and invite their employees to participate. We have some clients that have Twitter accounts just for their wellness program, and they'll use that to engage their employees. Or they'll host in-person conversations and strategy sessions and idea sharing. But it's all about letting employees share information, share tips and tricks, give advice to each other. This generates a lot of content, and it becomes highly engaging for each individual employee. People love to share things that they've learned and their ideas and their tips for success. So allow your employees and people in the community to do that. A fifth way is to enable public expression. So on a social networking platform, this is your profile where you upload your photo and you talk about yourself. But in a worksite setting, this could be a photo of you doing something healthy. Solicit those photos from your employees and share them with the company. Or it could be simply success stories that you've had. It's amazing what one employee's success story, when shared with the rest of the company, can do to motivate people to take action on their health. Another concept is using peer encouragement. So I love this idea. At Google, they have this thing called a peer spot bonus. And when you spot an employee doing something good for the company, you can report them to HR, and they actually get a cash bonus. It's amazing. 93% of all Google employees use the program every single year. Imagine if we took a program like that and applied it to health and wellness, where if you saw a colleague doing something healthy, you could give them a peer spot bonus, and they would receive some type of reward or recognition for that healthy activity. It doesn't have to be monetary, but even something that recognizes the fact that they were doing something healthy, like taking the stairs, or encouraging their colleagues to do something healthy, walking around the building during lunch. The idea of letting colleagues recognize each other is a really powerful way to motivate employees to change their behavior. And again, asking employees to invite and encourage each other to do things becomes really powerful. We can nag our employees as much as possible to take a health risk assessment, or schedule their annual physical, or to get their flu shot. But when it comes from a colleague, they're much more likely to actually do those things. Another interesting concept is sharing status and comparison. So we all love to know the answer to the question, how do I compare to the people around me? And am I above the average, below the average, or at the average? So if you're hosting some type of competition or collecting some type of data about employees, it's really important to share that data out and let people know what's the average. How many steps is the average employee at our company walking? How many pounds on average have we lost? People love to have that benchmark for success. And they love to see if you can break it down by gender and age and worksite if you have multiple worksites. So it becomes really highly targeted and relevant to them. And then people love titles and recognition. So there's this idea of Girl Scout badges or the different colored belts in karate that signal different levels of achievement, and they become highly motivating not only for the people who earn them, but for the people around them who see them and want to earn them. And you can use those types of titles and recognition badges that don't cost any money to recognize employees for being healthy and taking certain steps toward their health. Some clients award titles like Team Captain or Wellness Champion. You may have your own internal wellness champion program. But think about how to use recognition to motivate people to participate. And the final way I want to talk about, and this gets back to my initial comment about financial incentives, there are ways that you can implement small amounts of financial incentives to have a much greater impact. And that's really leveraging the idea of tying them to social behaviors. So instead of giving each individual an incentive for doing something, make that incentive contingent upon a group of people doing something. So when somebody joins a wellness program, find out who referred them. And if there are people within your organization that are the most common referrers, those are people that perhaps deserve some type of incentive. If you have an event like a flu shot clinic or an on-site wellness fair, give people an incentive to drag a colleague along with them so they're not showing up alone. It adds a social element to the program. When we host competitions, we often encourage clients to give an incentive if the entire team completes the competition, not for the individual. And that gives people an incentive to persuade their colleagues and engage them and motivate them to actually complete. And then you can do fun things like best team name and best team photo. These are social concepts that don't cost a lot of money but become fun and highly engaging for people. So those are the 8 ways that I wanted to propose to you. I hope even one of them sounded interesting and relevant to what you're doing in your worksite. And if you walk away and even think about applying one of those concepts to your wellness program, then I think we'll achieve our goal today. Now I want to talk a little bit about outcomes before I finish. So this all sounds good, and we'd love to believe that it works, but what are the actual outcomes associated with it? Well, here you see a chart about typical engagement rates with and without financial incentives. And this is data from the National Business Group on Health and Towers Watson from actually just about a month ago. And what they found was that in traditional wellness programs, coaching, weight management, they're seeing single-digit engagement rates. Even with incentives, they're seeing low double-digit engagement. And what we see across our book of business at Shape Up the Nation using this social component is that without incentives, you can engage 30 to 50% of your population. And with financial incentives, you can bump that up even further. Now, so we're not out promising that 100% of all employees will be engaged by using a social construct, but you can see that doubling or tripling or quadrupling your engagement rate can have a tremendous impact on your return on investment and on your company culture. Now, there are 3 case studies I want to share with you quickly. This company, some of you may have heard of, called Spirion Protection, based in Rhode Island, 3,000 employees. Really tough to reach environment, manufacturing employees who don't sit at a computer and are spread out and are really busy during the day. They rolled out this program and they got 80% of their entire company engaged through this program. They leveraged their line managers and their site directors on teams and to engage people. And they said this is the most successful approach they've ever taken to a wellness program. There's another company, Jarden, which makes a whole host of consumer products. They had their CEO go across the nation and run 5K races to raise awareness of this program. And they got a 40% company-wide engagement rate. Again, manufacturing environment, not an easy population to reach. And again, this was the highest engagement they've ever seen. The third company, and this is an insurance company, Highmark, in Pennsylvania. Even as a wellness healthcare organization that has a really robust wellness program, this was the highest participation they'd ever had in a wellness program across their population. So, from an engagement standpoint, we've shown that this approach can be wildly successful. And then, quickly, I want to share with you some actual health outcomes. This is a study that we did with Dr. Wing. It was published in Obesity in 2009, and it was based on 3,000 participants in our Shape Up Rhode Island program. We followed them for 16 weeks during the program and then for 6 months after the program. And this is what we found. In the program, the average participant lost 7 pounds, reduced their weight by almost 4%, lost 1.2 body mass index points, which is as you know, clinically significant weight loss. And my favorite statistic, 58% of people lost 5 pounds or more in the program. What was fascinating is the 6-month follow-up showed that 78% of the weight loss had been maintained. When you think about a weight loss intervention, that's really the holy grail, is the maintenance piece. You can get anybody to lose weight, but 6 months out, almost everybody has gained that weight back. And we weren't able to specifically show why these people kept the weight off, but the hypothesis is that they modified their social network. So when they went back after the program to their friends, their family, and their colleagues, those people were continuing to support them, and their environment was conducive to maintain behavior change. And we saw that bear out in the data. We actually shifted people down the body mass index curve. We shifted people down from the obese category into the overweight category, from the overweight category into the healthy weight category. We actually increased the total population of healthy weight folks by 8.5% in just a 16-week period. So pretty dramatic changes. You can imagine how this bends the cost curve for individuals. And then we did a return on investment study with one of our clients. It's a Fortune 20 company that looked at claims and did claims analysis with MedStat. And they found that among participants in this social networking-based program, spending on depression, diabetes, hypertension, and Crohn's disease all decreased. And they found that within this population, their medical and pharmaceutical spend went down while it went up for all other employees across the company. And they also found that the program participants had higher preventive screening rates, so they were more activated to take control of their health, and they were going to their physician, and they were doing the things that we all know we should be doing. So this doesn't prove causation, but it proves high correlation. The people in this program were dramatically more engaged with their health and did decrease their healthcare costs year to year. And in the end, we talk a lot about cost savings and return on investment, but this is really why we do this, and why we're promoting health and wellness. People who are changing their health indicators, they're reducing their cholesterol, their blood pressure, they're taking action on their health for the first time in their lives. And, this is what we love to see, success stories like this. We've seen thousands of them across the nation, across the state of Rhode Island. And it's really all about this unique approach, bringing people together to support each other. So I'd love to end on that note and answer any questions that you may have about what we do at Shape Up or about this social approach. I'd love to hear about what you're doing in your work sites and in your community program. I'm not sure how much time we have. But,
do you have a website?
We do. So our community program is at shapeupri.org, and Shape Up the Nation is at shapeup.com.
What are some of the reasons that a company that you might approach, why they don't want to do it? What do they say?
I think there's some level of fear about what happens when we let our employees take control and communicate with each other. And I think in the past maybe HR departments have been burned, but I think that's really the objection that we see, is people don't feel that they're ready to take on something like this. What we find is that it becomes nothing but positive energy from employees. So employees are grateful that their employer is giving them this opportunity, trusting them, empowering them, and they have so much fun in the program that it's a credit to their employer, and they recognize their employer for that. So I think there's some fear. Human resource professionals are all about managing risk, right? So any opportunity that there is for somebody to say something that other people are going to read, or when you connect people, there's power in numbers, and what's going to happen is there going to be a coup. But we find that it just doesn't happen. But I think that's one of the biggest barriers that we find.
Has this model worked with small businesses? How can you link small businesses together into some sort of social network?
Yeah, so I think our Rhode Island program is a great example of that. We have 250 small companies in Rhode Island. There are no large companies in Rhode Island, maybe one or two. We have 250 small employers in Rhode Island, all working together as part of the program. So their teams not only compete within their company, but they compete against all of the other organizations. And when I say compete, it's really a friendly competition. They benchmark their progress with each other. They all come to the same events that we host. They're all sharing information with each other. They're all sharing best practices for how to promote wellness in the workplace. And so we find that you can create this collaborative or consortium And there's no better way to do that than through a social approach, right? That's the whole philosophy about it. It's not just bringing individuals together, it's also, so we roll the program out. What we like to do is we like to find the early adopters. If any of you have read the book, The Tipping Point by Malcolm Gladwell, he talks about mavens. And the mavens are the people around us who have a lot of influence on us. They have more influence than the average person. These are the people who have a lot of information and they're really excited. In your workforce, these are the people who organize people's birthday parties, and they're always the first person to sign up. They're often the first people to sign up for the wellness program. We identify those individuals, and we invite them to become the team captains in a program like this. So we leverage their enthusiasm and their social influence, and we invite them to be a part of it first. And those people love that. They love that recognition. They like that buy-in. And usually it's about 3 to 5% of your population. So there's not a lot of maintenance, but they have a ton of influence on the people around them. We get those people in and we ask them to form a team. And then those team captains go out and they recruit their team members. And so we say, okay, if you're going to be a team captain, you have to recruit at least 5 people to be a part of your team. And they go out and they start sending out invitations, whether electronically or printed. And they have 4 weeks to recruit their team. They all go out diligently and they recruit their team. The average team size in our program is 7. So each maven is going out and getting 6 people whom you may otherwise not have engaged in your wellness program. But because they have influence and they know who to talk to and they have friends, they get those people involved. Then what we generally do is we launch a team competition. The teams will compete over a 12-week period to see which team can lose the most weight, exercise the highest number of minutes. We give them pedometers and we have them track their walking and they can compete on that as well. We can create competitions around any concept, so we use fruit and vegetable consumption and all kinds of healthy diet programs to motivate people. We find that it's really nice to launch with a physical activity component, just because it brings everybody together. We can actually get men involved if we use physical activity. If we run it as a weight loss or nutrition program, forget about it, they don't pay attention. But if we can make it somewhat competitive and have a physical activity component, we find that we can actually engage a diversity of employees in the program.
Have you had any luck working with city government in terms of programs?
Limited. Excuse me. We've always had support from the Department of Health in Rhode Island. We're very grateful for that. And as you may know, Rhode Island became the first well state in the nation based on the percentage of employers in our state who offer wellness programs. And that was really an initiative led by Governor Kucheri, our former governor. And we've always had, the governor became one of the co-chairs of our program and supported it. Every place he talked to, went and talked to, he mentioned our program and was really an advocate for wellness. We haven't quite figured out how to get this type of intervention into a government worksite, or really how to get the supportive financial resources that it takes. I think, while the government is self-insured, they don't necessarily think of themselves as a corporation, and they're not always concerned, specifically about the bottom line, or really looking at innovative strategies to affect the bottom line. So I think we're seeing more of that, so with the healthcare reform bill and a lot of money going into prevention and tax credits for employers. The federal government itself has a huge initiative and impetus for rolling out wellness programs across the employee population. So I think we're going to see more of that. We haven't done a lot of that to date, but we'd like to see more of that. And I think Massachusetts is maybe even a little bit better than Rhode Island when it comes to government action on health and wellness.
Here in Massachusetts, we have 60% smoking rate, but in the 2 communities, South Coast and Big City, Colorado, we've got 30%, double. I think it's a lot higher than Rhode Island, for example. Do you think this works with smoking? Because we have a terrible time. Lots of organizations, the hospital and the community health center, try to offer those groups to the public and to their employees, and they don't take them up on it at all.
Yeah. Yeah, absolutely. I mean, the thing about smoking is, when you're a smoker, you really don't want anybody to tell you what to do, right? When you're ready to quit, it comes from you and your own personal readiness to change. There's a program called QuitNet that you may have heard of. Excuse me. QuitNet is a social network for smokers, and it's not about connecting with people necessarily. It's about connecting with other people who are going through something similar that you are. and it's been a wildly successful program. It was actually founded here in Massachusetts, and that model proves to me that this is something that could work in a smoking cessation environment. We've always hoped at Rhode Island to create a smoking cessation challenge. It's never gone off the ground, but it's something we've designed and we're hoping to implement one day. So I think it's highly relevant there. All right, I think we'll let the conference go on, but thank you so much for your attention. I appreciate it.